Hi, my name's Sara Rapuano, and I'm the Chief Operating Officer of Wills Eye Ophthalmology Clinic in Philadelphia. I've spent about 20 years managing different practices within Wills Eye, starting with Corneal Associates and doing a lot of things with Wills Eye in terms of education, et cetera. We have found that OMIC's really easy to deal with when we have fellows. We have new fellows every year. We have them in fellowship slots so that it's a very smooth process to get our new fellows credentialed and get their insurance up and running quickly. Whenever we call with any questions about the paperwork, or when our fellows more commonly call asking questions, they get easy answers and they get it done pretty quickly. And the other thing that we've spent a lot of time with OMIC is just using the educational resources on the website. Whenever there's a question about how we should explain a procedure, we go to the forms library and we pull up the consents. The consents are great. They're written in English that a patient can understand. I use it to help train my staff when they're new and they don't understand the surgical procedures our surgeons are doing. So it's been helpful in many ways. It also has the Spanish versions, which is great because we do have a lot of Spanish-speaking patients. And so we've used that kind of in various ways using those forms. We call in to the hotline when we have a patient that's giving us a particularly difficult issue. We have wanted to terminate patients in the past who have just called over and over. And before we do that, we want to make sure we do everything legally that we have to do to take care of that patient. So we use suggested letters that we've been given when we've called into the hotline, and follow the guidelines where they tell us to send everything certified, et cetera. So that's a great resource. When we just have a patient that's unhappy and has had a bad result, and again, we want to make sure we're dotting our I's and crossing our T's, we'll call in and just explain the situation, and the hotline's very helpful on that perspective as well. We've used OMIC by having them come in and give educational programs at our Wills Eye annual conference, and I've been to lots of OMIC's talks at the Academy and at ASCRS and everything. And one of the talks that I find particularly interesting is when they give examples of telephone triage situations that have led to liability. And I've really used that discussion about telephone triage and the potential liabilities as I train new staff. I do a lot of EHR training, and in our particular EHR system, we have a beautiful telephone triage template. And to try to stress how important it is the doctors document appropriately in that EHR, I always go back to this sort of liability issues surrounding not documenting something and some of the stories that we were told in the educational programs from OMIC. So that's been very, very helpful. And I do most of the training for residents and fellows in the building at this point on the EHR. So I always go back to those liability discussions. If it's not in the record, it wasn't done. I have a lot of discussion about doctors who are very thorough in their medical care, but not as thorough in their documentation. And when they kind of look at me and say, well, you're just worrying about, coding and reimbursement, I said, no, this is protecting you. Just trying to teach the residents that it's really a protection for them to document thoroughly. It also helps my reimbursement, but the stories that I've heard from OMIC, it's a great way to teach them to kind of start their practice in a safer way. And with secretarial staff answering the phone, just stressing exactly what they need to document. Every conversation just goes on paper. If they've advised a patient to come in today or tomorrow, and that patient chooses not to come in, then we've got that documentation that we stress to the patient that we wanted them to come in today, that we made an appointment available, and they made a choice not to come in. So those are sort of some of the things. I mean, it's really just been a great educational resource for us. Educational when I come to these programs and hear them, educational when they come to Wills and teach our staff and our doctors. And educational because it's on the website and it's got lots of good forms and things that we can use, and the consents, and all of that's just been very helpful to me and certainly to our whole practice and to Wills as a whole.